I'm going to start out with about just a few minutes, maybe 10 minutes on company overview, product overview, and some industry challenges, and then we'll get right into a demo of our latest health consumer product and actually demo that on the mobile device. So just to jump right in, who we are again, Cobalt Talon. We're strictly focused on healthcare analytics, and what we do, we basically try to take raw data and whether it be consumer claims data, clinical data, so forth, and turn that data into valuable and most importantly actionable insights so that our customers, again, which are the likes of health plans, accountable care organizations, health systems, can lead to effective and efficient business outcomes with that data, basically leveraging data for a strategic asset. And how we do it, really, we talk about three ingredients: healthcare and business intelligence expertise. Most everyone on our team, especially the leadership group, has well over 20 years of experience in either inside of health plans, health systems, as well as combining that with the field of BI, data management, analytics, and so forth. That's the first ingredient, again, the people. Second is working with great companies like MicroStrategy and taking our knowledge, domain knowledge of healthcare data with state-of-the-art technologies, MicroStrategy, again, as the perfect example. And then third, best-in-class analytic methods. And so it's really all about, again, making that raw data smarter. So we have a variety of both commercially offered as well as proprietary analytic methods that I'll get into in just a second when I go over a product and service overview. But again, taking raw data, making it smarter, moving it down the continuum to business action. So this next slide really is a portrait of our product and service offerings, and I'm actually going to start on the right hand of the slide because this is what you'll see in the demo. So we have several hosted analytic products, everything related to a health consumer module, a population health module, healthcare provider efficiency module. We can facilitate employer group reporting, and then we also have available for someone who wants more of a full replacement in their enterprise, an enterprise platform that would encompass virtually all the aspects of the individual modules. So they're all built to be intuitive as far as their design. Again, MicroStrategy is the BI interface for all of our modules, so we're using best-in-class technology there. Each of the solutions are hosted and component-based, so we can customize by building in or taking out certain components to keep costs under control for the client, as well as making them much more sophisticated if they wanted to, if their maturity level as far as use of analytics is greater than another company. So that's the right side. Again, you'll actually see a demo of our health consumer product in a few minutes. So I won't. I'll go back to the left now and talk about our data enrichment services. And before data ever gets to one of our hosted analytic products, we spend a lot of time, I think I mentioned earlier, kind of making that data smarter. And so within our data enrichment layer, we have several analytic methodologies, whether they be risk scoring methodologies, propensity modeling, for instance, likelihood for a consumer to purchase a certain insurance product, or likelihood model for someone heading to the ER more likely than the next person. In addition to that, in this layer we can also append purchase consumer data, which makes the combination of that data with medical data much more valuable as we start doing predictive modeling and so forth, as well as creating segmentation, whether it be demographic segmentation or psychographic segmentation, so we can start to answer the questions after we identify a certain population, how might we engage the population or the specific member in that case. And finally listed there is a patient attribution model. It's become very important in the industry with accountable care, patient-centered medical homes, and so forth, to be able to make a connection between a patient and the provider who's actually taking care of that patient. So we actually have a proprietary attribution model there. On the far left, we illustrate our consulting services. And so obviously we've built a lot of hosted products and data enrichment services that we can offer, but we also bring a lot of expertise. As I mentioned, 20-plus years experience for most of our team. So when it comes to just helping people with the strategy and roadmap around either data management or analytics, we can provide that. Oftentimes we're actually deploying a product of ours as well as deploying analysts to help end users either build an analytic maturity or just serve in that capacity for them. So the last point on that blue box on the left, the consulting services, mentions project accelerators. So that's really where it comes in. The two boxes on the right and our experience with data enrichment and building hosted analytic products we can leverage over into our consulting practice and help others build inside of their own four walls if they're not interested in a hosted application. So that's an overview of our product and service offerings. But really, as we start to interact with any customer or before they become a customer, we really like to figure out, what challenges are they facing or what business opportunities are they trying to achieve by using data as an asset and analytics as a path forward. So these are just a handful of challenges today, and there's many more, and often these are actually all in a very high-level categories. But when it comes to improving quality of care, in consumer engagement, provider efficiency, increased revenue, contained costs, those are all very lofty objectives and can be sliced into many different components. But those are the sort of business challenges that are facing healthcare executives today. And I think it's safe to be said that without a data-driven analytics platform or initiative or strategy behind those, you can't run the business of healthcare, whether it be a health plan or accountable care organization, without a good solid foundation of data, how to use it, and how to turn that data into impactful insights. Our demo that I'll get to in just a minute, I think you're all waiting for, is actually designed, our health consumer product is designed to meet several of those business challenges. Really in the three bullets on the bottom right there, population health management emphasis. So when you think about a consumer product, you may not always think about the health side being in the equation as far as the product, but we actually have merged a lot of health risk information, as you'll see shortly, with the consumer data, so that again we can use that as a basis for segmentation and so forth, and find the population that can successfully be managed, and then help customers discover how to manage them. A focus on consumer engagement, you'll see that our product goes all the way down to the detail of an individual person. We can help customers with their current customer base as well as their prospects. And again, not only finding who to help, but how to help them engage in the healthcare system along the way. And finally, all of this really starts to boil up and support the movement in the industry towards value-based healthcare. If you think about what's going on with a lot of the shared savings programs and the tremendous pressure to cut costs and improve quality, as well as improve patient satisfaction, which is the triple aim goal, there's so many things that can be achieved through better consumer or patient engagement and just an overall better management of population health management. If you think about items such as improving the number of wellness visits per year for Medicare patients and what that can do for an overall health status of a patient going forward, just to get them to engage in the system, as opposed to the majority of what's going on now, where people seek care when they're sick, not when they're well. So items such as that and our tool, as well as some of our other modules that you won't see today related to population health management, are designed to do just that. The data flow diagram for health consumer, kind of already explained this a little bit, but if you go from left to right on the slide that's up right now, we consume as much raw data as we can get our hands on, basically from a customer. The minimum requirement to make our health consumer module work is very small, because we can start with basically name and address and go out and get a nice set of consumer data to start with. But ideally, it's nice to have consumer data, health claims data, possibly some patient data. So we take all of that raw data, land it, and basically send it through our data enrichment staging process, which I discussed earlier. So this is where we take that very raw, often complex not so easy to understand data and start making it more intelligent by adding risk scores. We slice the patients or consumers into demographic segmentation, psychographic segmentation, and apply several predictive model scoring devices here. Again, to take that raw data and start to make it not only less complex, but more meaningful as it moves across the continuum. And finally, we land that on you see Teradata is the database platform that we use there. So a high-performance analytic data mart that's proprietary to Cobalt Talon. We built the data model to land the data. Not only the raw data comes along, the enhanced, enriched data that I just discussed, put it on proprietary data mart on top of Teradata, and then MicroStrategy as our business intelligence delivery tool on top of that. So from there you can get reports, dashboards, self-service analytics, and I will demonstrate mobile today, but obviously this is available through the web version, desktop, full power user version. So that's a quick view of how the data flows and the technologies that we use to make that happen. And finally, the last slide before I actually switch over and get to the demo is just a sample use case. And this is just kind of a way to think about, again, I mentioned earlier, how to identify the who, but also the how. So if you think about the matrix on the far left, we're looking for, could be any situation, high potential candidates, and then a high probability to act. So a lot of times we might have a value segmentation in place where a customer of ours has classified their customers as, from low to high value based on whatever criteria that might be, and they have a chance of actually retaining those customers upon renewal or losing them. And so that's where we can run probability models of, probability to cancel as an example. And so what we're looking for are scenarios where we can narrow the focus so that our customers can use the fewest number of resources to get the highest impact possible. And so in this case, if we're talking about direct consumers and you move that along the continuum to the middle box, we actually apply psychographic segmentation to those same narrower set of members that we identified in the previous analysis represented by the grid, and then we can start to inform our customers on how you might approach different categories of people based on their preferences and how they like to interact with the healthcare system. And so it's not only preference related to the type of communication they get, whether it be direct mail, email, or phone, but things like, do they follow doctor's orders strictly, or do they avoid the doctor at all costs? So those are sort of things that we're trying to get to with our solutions. So with that, I'm going to pause a moment here and move over and share my screen and get into the actual demo. So this is our live demo portion, and again, this is our Cobalt Talon Healthcare Consumer Analytic Module. And we always build our mobile dashboards as kind of a storyboard, an analytic storyboard, which is intended to be a guided analytic that starts off from a very high level, in this case looking at a certain population, and then very quickly, as you'll see in the next few screens, gets us down to a very low level of data that could actually take action on. So I'm going to start by explaining each of the four quadrants on, again, this high-level view of the population. And if you look at the top right quadrant, it's really intended just to be a set of several important key performance indicators for the population at hand. And we've segmented those into very low health risk to high health risk, you can see across the continuum, and put some typical KPIs in there related to average age, cost, et cetera. And then towards the bottom, I think one of the more interesting things related to this quadrant, you can start to see the very low category of health consumers in this population. If you read this, explain this metric a little bit, about 97% of their risk condition actually comes from a single condition. And if you follow that to the right, all the way to the right of the very high, you can see that only 36% of the very high population, the catastrophic, actually comes from one condition, which it's not, I don't think that's a rocket science finding, but basically just tells you that there's a lot of comorbidities going on, a lot of complexity as people go from a healthy status to a pre-chronic to chronic and then catastrophic state. So the tool is designed to really allow users to segment populations both on health, and then if you follow that straight down, and you have a demographic view of the same population, and so you can see the customers, how they break out, and you can through radio buttons on the actual application, you can start looking at it by education. You can see those with high school diploma, some college, bachelor degrees, so forth, or presence of children in the household. So again, taking the same population above that were customers and giving a quick high-level demographic overview of that population. And then on the bottom of that same chart, you'll notice we go from customer to actual prospect. Those would be the potential customers in one of our customers' area that they may want to try to encourage to become customers of their health plan, or to encourage them to come in and visit their provider practice or become part of their ACO. So we can give both a current customer view as well as a prospect view of the world in this application. Staying on this and going up to the far right, top corner right, we have what's called our propensity bands. And really, you can have an unlimited number of propensity models, but if you think about a propensity model, it's really the likelihood of a person to behave in a certain way or take some certain action. So I'm going to focus on the far right bar. There's 4 models in here right now, one for emergency room use, high-risk patients, health savings account, and inpatient. And so again, we just selected these for our demo, but these could actually be any variety of propensity models. So the ER model that I said I would focus on, it basically is trying to predict in advance customers in this database that are likely to go to the ER more than 3 times in 1 year. And you can imagine it would be very beneficial for a health plan or a accountable care organization or patients in a medical home to know who those folks are that are most likely to do that, so that they can deal with either access of care issues or other things that are going on with that patient. So one of the things we like to do is, if you look at the radio buttons kind of at the bottom of that graph, if you turn off the actual high, average, and low propensity for that particular graph, you can start to see the tails. And so you can see very quickly the very low and the very high when it comes to ER utilization. And so from a care management standpoint, you go from, I believe there's 81,000 customers here to about 14,000 that fall into the very high category that are very likely to show up in the ER multiple times a year. And so you can customize the campaign or something, or even investigate that population further to see if they're coming there for the right reasons or if they're coming there for routine care. And again, it might be an excess of care issue. So that's just a quick example of how something like that might be used. On the bottom right is a quick overview of the same population. Again, if you look at the middle, there are 81,000 customers in this actual example, and this is where we break them out into what I mentioned earlier, psychographic segmentation. So of this population, and we're going to get into this a little bit deeper in the demo pretty quickly, but you have segments related to people called direction takers and willful endurers, and those have different meanings on how you can more effectively communicate with each of those audiences. So again, this is our first screen of this, and I'll move on in essence of time, but we always like to start again at a high level of the population as our first view. Our next view is what we label as risk segmentation. And so again, I think what's a little bit unique about our product is that we've brought in a lot of health risk information into this particular health consumer module without bringing in the full details of claims. We have another module, Population Health Analytics, that has the full detail of claims, but this is intended to bring just the right level of, again, health information together with consumers so that you can get to more of those patient engagement type initiatives. So this particular screen is where you can start to really filter down on the population you want. If you can see the slider at the top right, I can filter this very quickly to just the high and very high concurrent risk segmentation band. And then along the left, you see a series of radio buttons with several categories of health. And what I'm going to do is I'm going to basically turn these off and just filter on, as an example, circulatory system, and I'll also add musculoskeletal system as a filter. Those are the two highest categories of risk. And what that's doing over in the grid area, you can see those two come up, and it basically provides a ranking. And so if you recall, 81,000 people in the demo database here, 5,177 had a circulatory system risk marker as one of their number one condition driving their health risk, and then musculoskeletal had 3973 and so forth. So those would be two areas of high volume as far as risk categories that the user of the system might want to look at. And then even from there, we start to provide other information related to second rank, third rank, fourth rank, and how, as you can see, slide across the middle there. So not only do you get information about what's driving just their primary driver of health risk, but you also get second, third, fourth, fifth, and so forth. The next screen, as I move across, you can see the tabs. I go from risk category to risk condition, and out of essence of time, I'm not going to go into this one and filter, but there's literally over 1,200 specific risk conditions that we could filter on that roll up into the categories we just talked about. So if a user were interested in something very specific, like a certain type of cancer or anemia specifically, you could filter here as well and get your population. The two screens I just went over are really intended to set a filtering criteria for the next two screens I'm going to show you. And so as I move on to the next tab, the demographic tab, you can see in the middle there's a risk category and a risk condition radio button there, and right now we're on risk category, and you follow that down to this filtering box, you can see that it carried over my filter for musculoskeletal and circulatory system that I had selected in the previous slide. So at this point, the user has been able to kind of look for some high-risk categories, use that as a filter, and then move that forward to this demographic profile of that population. So the top left here is really some person count, broken out by age, percent female, average household income, some stats like that. And then the donut chart is really breaking them into some, again, more demographic categories related to income, age, and so forth. The next tab is actually, to me, much more interesting than the demographic, and that gets to the psychographic segmentation view of the same population. So again, on the bottom right, you still have the same filtered population, the musculoskeletal and circulatory, and now we've broken it into the 5 psychographic segments that I mentioned earlier. So the psychographic segmentation, there's much more detail in this related to how you should communicate with members for the best patient engagement. But basically, if you see the radio buttons on the left, it talks about who, what, and how. So if I pick on this direction taker category over here on the right, you can see that as far as who that segment represents, they're people that often struggle with their health, but they primarily look to their doctor and other healthcare professionals for guidance, and they don't seek that information out on their own. It's really when they become sick, they look to their doctor. We can toggle to the radio button that says what, and they basically also have a lower level of awareness. I'm reading out of the box over here. So you have 2,000 people with that criteria. They have a lower level of awareness and involvement in gathering their own health information. I kind of already said that earlier, but they really look to that doctor. If you compare that to someone like a willful endurer that I didn't read the WHO category on, but the willful endurer is almost the opposite of a direction taker. They avoid the doctor at all costs. And so if you can imagine trying to do a blanket campaign to get a direction taker versus a willful endurer to come in for a wellness visit, you would take very different tactics as far as how you would approach those individuals. I mean, a direction taker might respond very well to a personal letter from the physician, but the willful endurer would probably throw that in the trash. So again, this is getting a little more into how you would approach these certain customers or patients in order to get them to engage in healthcare activities. And the previous screens were really how you find the right people to take to this level. So the next screen in the analytics storyboard has to do with propensity segmentation. So I demonstrated on the first page that we actually have 4 different propensity models in this demo. This could be a list of a dozen. It just depends on what the customer is trying to actually predict that we help them with. And so this one, again, focusing on ER, this particular model is looking for people with a propensity to go to the ER more than 3 times in 1 year. So if you look at the top right banner here, you can see, if we're on the ER propensity model, we could look for those potential patients that fall into the very highly likely category. And, at that point, you actually have, 14,516, which I think was the same number from that very first slide we were looking at. And now you can break them into these, both demographic on the left and the bottom right psychographic. And this is a good place to pause and also demonstrate what I did there is I just basically clicked on one slice of that pie below for the direction takers. And so this is basically a list of detailed patients, members. Obviously for the demo they're not real, but people that are most likely to go to the ER over 3 times in the next 12 months. And so now a customer of ours would be armed with this information, and they might do some sort of an outreach campaign or look to their provider network to improve access or whatever the strategy may be. But they could actually customize that strategy towards which psychographic segmentation the most likely to go to the ER fall into. So that's a good illustration of the power of even the mobile to be able to go from a very high level to a detail level just that quickly. I'll move on to the next screen in essence of time. This real quick is an example of visualization analytics, and so we can take other segmentations. This happens to be Experian Mosaic segmentation, and we could look at, for instance, a category called Platinum Prosperity. You can see the filter up in the far left-hand corner, and on the far right, I'll just use the propensity categories again, and so you can start to look at things for this particular segment where you've got the left axis represents their propensity score, and the bottom axis is their age, gender, risk score. So you can see this particular mosaic segment move up and down according to the model we're looking at. And so you can see in this particular case, I'm focusing on the 3 large bubbles at the right side, and you can start to see how their high risk propensity is relative versus their inpatient versus their ER. So some quick ways to really look at visualizations where, in this case, if you wanted to find, again, the highest risk set of members for this particular segment and the highest propensity score, you could get there pretty quick. And then at the bottom, we typically give a data grid to where you could not only look at it visually, but see all of the actual KPIs for the graph as well. I'll go on to the next. This next screen is really a culmination of everything I talked about so far, except for it's built at a very detailed level, so around a particular customer. So it's a 360 customer view. So you can see this is filtered to a specific person in the database, and very easy to filter from person to person. So the application of this might be in the hands of an actual care manager who really wants to get a 360 view of the person they're talking to on the phone, not only from a demographic standpoint, but the psychographic segmentation that you see at the bottom. The chart on the far right gives a cost by clinical setting comparison for the last 12 months. The donut chart in the middle actually gives a profile of their risk scores. And what I did just now was I tapped on the orange slice of that, and above it basically in the title of that risk score, average risk condition score, it basically says 25% of that person's risk, which happens to be 4.87, came from complications of procedures. So something went wrong during the procedure, and that caused 25% of their health risk over the past year. We could also look at that on a prospective basis and see what in the coming year is going to be driving this person's risk. And so this, again, is just a very good comprehensive way to see as much about a single patient or customer as you can. And at the top, I'm scrolling that banner. This just starts to demonstrate that, at a detail level, we can put a lot of consumer or other medical data, health risk assessment. You see BMI values and so forth on this as well. Very customizable to the detail that we have available. And then I think we have one last screen, and then I'll move back and hand this over to Jeff pretty quick here. And finally, what you have in front of you here is a map, and so we assign geographic coordinates to basically every address that we put in our system, whether it be a provider, member, consumer, or prospect. And it starts to give the ability to do visualization at a geographic level. And so in this case, you can see we have many filters on the left. Right now we have propensity for high ER utilizers selected, and I'll just leave it at that for now, but you can kind of see some nice variation in the graph where you've got high utilizers red during a certain, along a certain corridor within the city here, a lot of moderate on the right side of the equation, and then less over here. If you knew a little bit more about this geography, you could probably put two and two together and see, what that means, whether there's a void of hospitals in a certain area, whether it's socioeconomic things going on or whatever. But looking at things from a geospatial view like this really helps sometimes companies determine and figure out that they need a different strategy for, say, a rural market versus suburbs versus core cities. So anyway, that's how we incorporate that into our visual application. And again, this is all MicroStrategy Mobile. We also have all of this plus a lot more of what we would say is a power user version of this available through the web on all of our hosted products. So this was our health consumer product, and again, we're very proud of what we put together there, and again have other products related to full population health analytics, provider efficiency, and so forth. Again, we really, just kind of an overview of this, like to, again, make the data smarter before it gets to that point so that the end user doesn't have to be quite as sophisticated, but they can just put the data to use as soon as they get it. We could actually bring this up with very few data elements. Obviously, it's better if we have full claims or patient data, but we can basically go off of less than 10 data elements to get a customer started with the product that you just saw. No hardware, software for them to install. And again, the goal is for the output to be easy to understand and for them to be able to apply to the business opportunity without having to deal with a lot of the technology. And it's pretty easy for us to deliver a solution like we just demoed in less than 60 days, assuming you take the philosophy of thinking big, starting small, and moving fast. And so.